Hello, this is Andre with Tongue Tales on Monday. And today's tale is about the tongue of a person with partially cystic, partially necrotic, pancreatic tumor. Now, let's see what this tongue would tell us. As always, we begin with the coating, and we can see that this coating is yellow, thick, dry, and old. And this indicates accumulation of phlegm heat. Now, the coating is also partially peeled, as you can see here. And this indicates stomach yin and kidney yin deficiency. And the tongue body itself is dry, so there is lack of fluids, and the size of the tongue is larger than average. It's a swollen tongue, which indicates an accumulation of dampness. Now, in terms of its shape, the edges of the tongue are swollen, and this is a further indication of spleen qi deficiency with dampness accumulation. Next, we can observe a depression at the root of the tongue, which indicates an onset of essence deficiency. And in this case, both yin and yang of the body have to be supported. We can also observe some horizontal cracks here and also on this side. You see that? And in conjunction with pale body of the tongue, we would determine that we are dealing with deficiency of fluids and blood. A pink pale body of the tongue, especially with more pallor on the sides of the tongue, is an indication of liver blood deficiency. And when the tongue is pale and moist, then we think of spleen qi deficiency. But in this case, the tongue is also dry, and therefore this is blood deficiency. We can also observe a deep vertical crack in the anterior one-third of the tongue. And this indicates an onset of lung yin deficiency. And we can also observe a patch of redness in the anterior one-third of the tongue, especially on the right side here, not so much on the left. And this is an indication of accumulation of heat in the upper burner. We don't have the image of sublingual veins for this tongue, but we know that they are normal, and so we rule out any form of blood stagnation. Now, let's unravel this. Thick, dry, yellow coating indicates phlegm heat rather than damp heat because the coating of the tongue is dry. When heat is greater than dampness, it tends to affect the upper burner and middle burner. And when dampness is greater than heat, it affects the lower burner because dampness drags heat down to the lower part of the body. In this case, we observe heat affecting the upper burner. So this heat cooks up the fluids and creates phlegm heat. So we will need to transform phlegm and clear heat. This phlegm heat comes in conjunction with yin deficiency. And the chief herb for this presentation would be Chuan Bei Mu, Fritillariae. This herb not only transforms phlegm and clears heat, but it also nourishes yin. The coating of this tongue is partially peeled, and the peeled coating right here. And the peeled coating is an indication of stomach and kidney yin deficiency. This coating has lost its root, indicating that fluids are not available for the formation of turbid steam that contributes to the formation of coating. The function of stomach qi is to ferment food and liquids. In the normal course of digestion, a little dampness rises to the tongue and forms coating. In case of deficiency, very little moisture rises, and this manifests as peeled tongue coating. And to generate fluids and yin, in this case, Shi Hu, Dendrobia, would be the herb of choice because it nourishes stomach and kidney yin, and it also generates fluids. We may also add Dong Shen, Codonopsis. This herb nourishes qi, and specifically it's very good herb in case where there is already heat and we are afraid to use nourishing, tonifying qi herbs because they would produce more heat in the body and contribute to other symptoms. But Dangshan is a very neutral herb, and that would be very good in this case. Next, we also want to observe that the tip of the tongue manifests this crack in the anterior 1/3 and indicates lung yin deficiency. And the herb of choice to treat that would be Mai Men Dong, Ophiopogonis. This herb generates lung yin, clears heat, and generates fluids. The root of this tongue indicates deficiency of essence. And so we need to address that with the herb called Huang Jing Polygonatum. This herb is also known as Solomon's seal. It's an excellent choice for treating conditions involving kidney essence deficiency, as well as lung and spleen yin deficiency and deficiency of fluids. So it's a very moistening herb. Now, in this case, we can observe that essence is unable to support blood because kidney yin supports liver blood. And in case of essence deficiency, blood becomes deficient as well. And so we want to add an herb that nourishes blood and essence at the same time. And Gou Qi Zi, goji berries, would nourish liver blood and kidney yin. This herb also benefits vision and overall vitality. Next, we also have to address the element of spleen qi deficiency and dampness. When addressing a scenario involving kidney essence deficiency, blood deficiency, phlegm heat accumulation, and spleen qi deficiency with dampness, the treatment strategy must be carefully balanced to target all these aspects without exacerbating any of the existing conditions. The approach in this context involves nourishing spleen qi and transforming dampness. We also must transform phlegm and regulate qi. We already have Dangshan, Codonopsis in this formula, and this herb facilitates spleen qi. We also have Chuan Bei Mu, Fritillariae, and this herb clears heat and phlegm from the lungs. Next, we also want to add Ling, Poria. This herb strengthens the spleen, leaches dampness, and it also transforms phlegm. Finally, we want to add an herb to regulate qi because this is a golden standard of herbal medicine. Whenever we are dealing with phlegm, we must regulate qi. And the herb of choice in this case is Chen pea, old or aged tangerine peel. And so this concludes the formulation for this tongue image. Now, if you want to see the whole list of herbs in this formula, please look in the notes for this video. And if you have any health issues and would like to know what your tongue tells on you, do not hesitate to write to us in comments, and we're gonna instruct you on how to send us the image of your tongue, so we can talk about it next. And I am Andre with Tongue Tales on Monday, and I will see you next Monday.